Hello, my name is Dr. Shora. I am one of the higher trainees in general psychiatry based in Leeds. Today I am going to give a presentation on the Royal College of Psychiatrists e-portfolio for core trainees starting training in psychiatry. I would like to state that I have had no formal training in using the e-portfolio, but I am going to use my experience from the last 7 years of using the e-portfolio to deliver this presentation. I would also like to thank the Medical Education Department at the Leeds and York Partnership NHS Foundation Trust for inviting me to deliver this presentation. The aim of this presentation is to give a brief introduction of the curriculum, the competency framework used, the intended learning outcomes, and I will also give a demo of how to use the e-portfolio, and we'll also talk about the workplace-based assessments. The curriculum for specialist training in psychiatry is competency-based and outcome-based. It's also learner-centered and supports trainees' progress in the core training. The curriculum is based on a model of intended learning outcomes with specific competencies, and these competencies are structured under the CanMEDS headings, which are medical expert, communicator, collaborator, manager, health advocate, scholar, and professional. Psychiatrist, being a medical expert, is at the heart of this framework, and there is overlap between different categories. The intended learning outcomes can be mapped to the headings of good medical practice, but at the moment CanMEDS framework is preferred. There are 19 intended learning outcomes for core psychiatric training, and each intended learning outcome has 3 components, which are knowledge base, skills, and behavior. The intended learning outcome from 1 to number 7 are about psychiatrists being a medical expert. Number 8 is about psychiatrists being effective communicators with patients, relatives, and colleagues. Number 9 is about working in collaboration with other professionals and agencies. Number 10, 11, 12, and 13 is about psychiatrists being effective managers. Number 14 is about the ability of a psychiatrist to promote public understanding of mental health issues. Number 15 and 16 describe psychiatrists as scholars. Number 17, 18, and 19 are about psychiatrists being professional at all times. The online portfolio has been in use since 2008. It's a web-based tool and allows trainees to build a portfolio of their professional activities, set learning objectives and personal development plans, link activities to curriculum, and record workplace-based assessments. The online portfolio is also used for annual review of competency progression. I would like to state that there is a video on setting up of portfolio online account on the ARCP Psych website, and there are also useful trainee guides and how-to guides in the help and support section of the portfolio online section. I will now log into my online portfolio and give a brief outline of how it works. Once you log in, you will see this page on the computer, and on the right hand side it will be your name, and if you click on it, it will give your details including your name, your GMC number, your RC Psych number, the school of psychiatry you are currently with, and the trust you are working in. It also gives you details about your specialty, your current training level, your start date, and once you have done more than one post, you will see the folders for your previous posts also in this section. I will now go back to the dashboard. So on the dashboard you can see that there is this dashboard, then the next is PDP, portfolio, supervisors, and forms. And on the dashboard you can also see you can start a new activity, a new assessment, you can request for a new review, and if there are any outstanding tasks, if people ask you to complete any assessments or give feedback, that will be popping up here. And your current PDP, it will be shown on this side, And if you have reviewed anything recently, that will come on this side of the screen. So if we start with the PDP, so if I click on the PDP, you can see 4 headings: personal development plan, curriculum coverage, exam results, and your career history. So if I click on the personal development plan, so in the personal development plan, when you start a new post, you will have to add a new learning objective for that post. And once you identify a learning objective, you have to link it to the framework you are using and the intended learning outcomes which will be covered by that learning objective. Once you have done this, at some point you will do your workplace-based assessments, and you can map the evidence of the workplace-based assessments with the intended learning outcome, the framework, and the learning objective you have set. I will just tell you how to map the evidence. So if I click on my assessment, so when a workplace-based assessment is done, you will see this form is saved on your portfolio, and at the bottom of this form, it will give you an option to say that do you want to map it to the competency. You will have to click on that link, and then it will take you to the competency and the framework, and once it takes you there, you save it, and it should come up on your portfolio as mapped evidence. On the dashboard, you can see the portfolio heading. If I click on the portfolio heading, there is activities, assessments, and reviews. Activities include all your professional activities like supervision, case log, and workplace-based assessments, while the assessments are only your workplace-based assessments. Reviews are your supervisor reports. If I now click on the supervisors, you'll see a list coming up. It should have your educational supervisor, your clinical supervisor, and your college tutor on the list. And to add it, you have to click on view all, and then you can add a new supervisor by clicking on this button. And finally, I will give you a brief outline of the workplace-based assessments in specialist training in psychiatry. There are 12 workplace-based assessments. The first one, as you can see, is case-based discussion. It's an assessment made on the basis of a structured discussion of a patient whom the trainee has recently been involved with and has also documented in their notes. The assessment of clinical expertise involves a trainee's entire clinical encounter being observed and rated by an assessor. The mini-assessed clinical encounter is part of a clinical encounter being observed and rated. Mini-PAT is a multi-source feedback obtained from a cohort of co-workers, and trainees should nominate 10 to 12 assessors, and ideally this should not include more than 2 assessors in any one position. The next set of workplace-based assessments are with regards to psychotherapy competencies. Case-based discussion group is to provide structured feedback on a trainee's attendance and contribution to a balanced group. Structured assessment of psychotherapy expertise is to provide feedback on a short therapy case, and psychotherapy ACE should be completed by the psychotherapy tutor following completion of a long therapy case. Direct observation of procedural skills is like a mini ACE but focuses on technical and procedural skills. In psychiatry, it's usually the ECT, which is classed under the DOPS. Case presentation is assessment of a case presented by a trainee during in-house teaching or at a grant round. Journal club presentation is similar to case presentation and is assessment of journal club presented by a trainee. Assessment of teaching is assessment of a planned teaching carried out by a trainee. Direct observation of non-clinical skills is to provide feedback on a trainee's performance of non-clinical skills by observing them, like chairing a meeting, supervising others, and any other non-clinical procedures. This table outlines the minimum number of workplace-based assessments a trainee is required to complete each year. I would also suggest to read the core module for specialist training in psychiatry for all trainees who are starting their core training in psychiatry. And finally, we have these couple of useful links. The first link will take you to the curriculum where you can go into the detail of the intended learning outcomes and curriculum for each subspecialty within psychiatry. The second one will take you to the online portfolio where you can log in, and the setting up of the online portfolio video is also on this link. Thank you very much.